Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahd Martin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. This program is broadcasting live from the Inspire FM studios today on 23rd of October 2025. The time just past 6 p.m. And we are casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden, Bedford, Milton Keynes, and our airways reaching to all our listeners who are listening us through Inspire FM radio app or website or viewing us through our Facebook and YouTube channels. So good evening to everyone. So in our show we do tackle unique different topics every single time, but today we thought let's keep it simple, let's keep it succinct, let's bring something back to normal, bring an issue which been affected with pretty much anyone and everyone is affected by it. And we talk about it every single day, we give reference about it every single day. And definitely it's one of those common things which we says, well, yeah, I don't know why, but I'm having that kind of attention. Yes, indeed. Today we will be talking about blood pressure, i.e., hypertension, its symptoms, its cause, and its effects of in our daily lives. Yes, you have heard me correctly. We are talking about blood pressure, which is also known as hypertension, and we will be talking about the symptoms, the causes, and its effect on our daily lives. And you will be glad to know that I'm not the person who will be talking about that topic. Otherwise, I will give you more attention. I have an absolutely exciting and absolutely brilliant guest with me today. He is the best of the all, as in my personal opinion, definitely. Uh, he was the very first guest of my show when we started back in 2013. It's almost, wow, it's almost 12 years, 13, oh, 13 years, almost 13 years. Wow, the time has passed really quickly. And he's a very dear friend. He's none other than Dr. Adil Khan. Assalamu alaikum, Dr. Saab.
Walaikum salam, Fahd. Nice to be back. And I want to say, in 13 years, you haven't changed a bit.
Oh, yes, I will not say that. I have now white hairs all over the place, which I need to get it colored.
I'll go to Specsavers.
Oh, yes, definitely. Good to know. Good to know. I'm not the only one who need that extra pair of eyes. But anyhow, how are you doing, sir?
Alhamdulillah, Fahd, I'm doing very well indeed. And mashallah, it's good to be back. Thank you for inviting me.
It's always nice to be with you in many different ways, shape, or form, because when I am with you, I'm very much relaxed and I sometimes go outside the scripts. As you know, you love that way. But Alhamdulillah. But today is one of the topics which is very common. But before going or diving into the topic, I'd like you to give us a quick introduction about yourself. I know 99% people know you in one way or another. Either they know you from the circumcision clinic, like just a couple of few people, brothers who just know you, mention themselves, been to your clinic, or they knew you from the doctors because you are a doctor in this city and in Luton since last 40 years.
1991, Fahd.
1991. Wow,
Yes,
that makes it
a long time.
a very long time. Exactly. It's not easy to do maths in the head. So, give us a quick introduction about yourself.
Ji, Assalamu alaikum, everyone. My name's Adil Khan. I'm a GP at the Kingsway Health Centre in Luton. As I said, as Fez described, I've been a GP in Luton since 1991. Both my parents were GPs in Luton since 1971.
Wow.
So I've been brought up in this area, and I have a lot of emotional involvement with the people of Luton. I'm proud to be a Lutonian, and I often tell the local doctors who work in Luton, I say, if we do not do anything for our own community, nobody else is going to do it for us.
Indeed.
So I'm very, very invested in the health of our community. And when I mean our community, I mean our community in total.
Indeed, indeed, absolutely, indeed. And this is a gray line which we always walk. But exactly as you said, the community in total, regardless of the racial makeup or caste or religion or any other background,
Absolutely
our
right.
community in total, definitely, definitely. And on that note, I must say, guys, if you have any questions or queries regarding our topic tonight, which is blood pressure, or also known as hypertension, give us a call on 01582 481822. I repeat, 01582 481822. Or you can send us your questions via text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. And definitely, if you have experienced some high blood pressure, low blood pressure, or mediocre blood pressure, or any kind of a hypertension, or any tension, you have the right person to give those tensions away. I know him. The laughter he's give is something which is to die for, definitely. uh, so jumping into our topic, Adil, let's ask, what blood pressure actually is, and what that number means. Those two numbers comes on a meter.
Sure. So basically, your heart pumps blood around the whole body through a circulatory system. And it's very much the plumbing system of your body. And the pressure with which the blood flows through your blood vessels has to be very, very tightly monitored and regulated by your body.
Mhm.
And this is very, very important because all your organs are used to your blood going into them at certain pressures, coming out at certain pressures. So rapid changes or prolonged exposure to very high blood pressure can and will damage them. And there are various organs that will specifically suffer from being exposed to adverse effects of high blood pressure. Now, you mentioned the two numbers. When you go to your doctor, he'll take your blood pressure, and you'll notice he'll come out with two figures. So basically, what you'll notice, he'll put a cuff on your arm, and it will compress your arm, and this will compress the blood vessel. This will compress the artery that they're taking the pressure out of. So the first pressure reading will occur when the pressure is released and the blood starts to flow back into that blood vessel after the release of the blood of the tight tourniquet. So that'll be the first reading. Now, as the blood vessel opens, there'll be a degree of turbulence. The blood starts flowing through, and there'll be turbulence. Okay. The lower reading will occur when that turbulence finishes. So that's where you have the two readings. One is called the systolic blood pressure. One is called the diastolic pressure. So systolic pressure is the pressure which the pressure at which the blood returns into the blood vessel after it's being decompressed, and the diastolic blood pressure is the pressure which occurs after the turbulence finishes, when the blood vessel is fully opened. So there you have your two blood pressures. Okay.
Upar wala aur niche wala.
Upar wala, niche wala. Okay. Now, contrary to popular belief, most people cannot feel their blood pressure. A lot of people will say, "Oh, I can feel my blood pressure. Tension ho raha, blood pressure." Most people cannot feel their blood pressure unless it's very, very, very significantly elevated.
Wow.
So when people say, "Oh, I can feel my blood pressure," most of the time that's not actually the case. Okay. And this is the problem, because blood pressure cannot be felt until it's very, very high. It can be a silent chronic killer. That means it can be causing problems to you, okay, whilst you're not knowing about it. And this is why blood pressure is very, very, very important. This is why it's very important to know your blood pressure. This is very, very important to regulate your blood pressure as well. Okay. So if you're over 40, you can get your blood pressure checked for free at the pharmacy. You can make appointments with the GP or the nurse at your at your practice. It's very important to get your blood pressure monitored and checked. Now, how many people does this affect? So the latest stats show that blood pressure affects 58% of people from the age of 65 to 75. So that's a lot of people. That's a lot of people. And in some communities, it can affect 5% of people from the age of 16 to 24 in some communities. So, this is significant. So it's very, very important.
So it does not kind of make differentiation between age, race, caste, color.
No, it does. It does, and I'll be coming to that. So the chances of you having high blood pressure can be age determined. So the older you are, the more chances are you're having high blood pressure.
Mm-hmm.
Okay. If you've got a family history of blood pressure, that can increase your chance of having blood pressure. Your ethnicity certainly does play a part.
Okay.
So people from the south, from Southeast Asia, from South Asia, people who are from Afro-Caribbean descent and Black African descent and Black Afro-Caribbean descent, we all have a higher incidence of blood pressure,
mm-hmm.
more so than Caucasians. So that is something to know about.
Okay.
Other factors which will cause you to have high blood pressure is a very unhealthy diet. So, if you're eating unhealthy, if you're eating fatty food, fast food quite a lot, food with a high salt content, that will predispose you to having high blood pressure. And if you're having these sort of diets, automatically most people will be overweight. So being overweight will predispose you to having high blood pressure. Drinking too much alcohol, drinking too much tea, coffee as well, and smoking. These are all factors which can cause a highering of your blood pressure.
Mm-hmm.
And feeling stressed over a prolonged period of time can influence your blood pressure as well. So these are factors which are very, very, very important.
Wow. Okay. So how can we manage these factors?
Okay. So the most important thing, as I said to begin with, is find out what your blood pressure is. As I said, if you're over 40, you can simply go to your pharmacy and they can check your blood pressure for free.
Mm-hmm.
If you're under 40, if you want to know your blood pressure, you can make an appointment with your clinic. As I said, you can still go to the pharmacy. You may have to pay, but that's okay. You can find out what your blood pressure is. It's very, very important. A lot of people have blood pressure machines at home these days. And you can take your blood pressure at home as well. So it is important. It's important. There are also, what I didn't mention from before, there are also medicines that can increase your blood pressure. So,
okay.
Yeah, absolutely. So some people who are on the oral contraceptive, certain combined oral contraceptive pills can influence your blood pressure.
Mm-hmm.
Being on certain anti-inflammatory drugs can increase your blood pressure. So anti-inflammatory drugs such as naproxen, ibuprofen, they can increase your blood pressure.
Mm-hmm.
Certain antidepressants can increase your blood pressure. And also certain cough remedies can as well. So these are things to be aware of. These are things,
cough medicine.
Certain cough medicines can increase your blood pressure. Yes.
Okay.
Yeah. There are secondary causes of blood pressure. Some people may have problems with blood supply to their kidneys,
mm-hmm.
And that can affect your blood pressure. There are certain hormonal imbalances that can give rise to higher blood pressures, like an underactive thyroid. So all these causes can be diagnosed and detected by your doctor and treated. And if they're treated, the blood pressure in most cases will be automatically treated as well.
Mm-hmm.
So as far as the numbers, the absolute numbers concerned, so if you go to your GP, they'll do your blood pressure. So if you're under the age of 40 and you're in the GP surgery, a reading of 140 over 85 is or less is acceptable. A home reading of 130 over 85 is acceptable. If you're over 40 years old, a reading of 150 over 90 is acceptable, or below, 85, sorry, is acceptable, and a home reading of 140 over 85 is acceptable.
Mm-hmm.
So if you go to your GP and you find that your blood pressure is elevated, most probably he will ask you to do a series of home blood pressure readings.
Yeah.
So obviously, when some people go to their doctor or nurse, just being in a clinical environment can increase your blood pressure due to stress at that point in time, stress or anxiety at that point in time. So having your blood pressure taken within a clinical environment is not always an accurate portrayal of what your blood pressure may actually be.
Why? Because you're just heavy.
You could be a bit anxious. You could be a bit, and that's normal. And that's normal. Some people's blood pressure, when they come into the clinic, can go sky high, and this is called white coat syndrome. It's a recognized syndrome whereby you are exposed to a clinical environment and your blood pressure goes very, very high, and that's a recognized syndrome.
Uh-huh.
So the GP will ask you to do a series of home blood pressure readings, or he may refer you to the pharmacy, and they can do a 24-hour, what we call ambulatory monitoring of your blood pressure.
Mm-hmm.
And then they can analyze the blood pressure, work out the average readings of your blood pressure, and come to a diagnosis, basically, and come to a diagnosis.
Okay. Now, you did mention about the high and low blood pressure. How common the high blood pressure or hypertension among the adults in UK and especially in Luton it is?
So in certain ethnicities, the incidence is about 58% in ages 65 to 74, which is quite high. And the actual symptoms of blood pressure that you may suffer are from headaches, blurred vision, and chest pains. So if you're certainly having very severe headaches and blurred vision, dial 111 straight away. If you're having chest pains, again, dial 999 straight away, especially if you have chest pains which are central going down to your arm, you've got shortness of breath as well. Dial 999.
Early sign of heart problem.
Absolutely. As I said, most people don't feel their blood pressure unless it is quite elevated.
Mm-hmm.
So even if you think you have high blood pressure, do not hesitate and go and see a healthcare professional about it, because it's very, very important to detect. The earlier you detect it, the sooner something can be done about it, and the sooner you can get treatment for it as well. And therefore, the less chance it has of having any prolonged effects on your body.
Right. Okay. So you mentioned about silent killer. That it's also known as the silent killer earlier. Why hypertension is called silent killer?
Well, I mean, if you had a broken arm, you could see it.
Yeah.
You see, so you can see that you've got a visual positive feedback. There's something wrong there.
Mm-hmm.
As I said, if you've got high blood pressure, most of the time you can't feel it at all. You don't know it's there. So therefore, it's there doing damage all the time. And the damage it can do is damage to your heart, of course. It can cause heart disease. It can cause heart failure as well. It can damage to your kidneys. It can cause damage to your brain as well. So, blood pressure is one of the fundamental causes of vascular dementia these days. It can cause strokes. So these are all, very, very negative outcomes due to the prolonged exposure of high blood pressure, which is not treated.
Right. So in terms of can someone have dangerously high blood pressure and feel normal with no symptoms?
It has been known, yes. It has been known. But when they come to our surgery, if they have extremely high blood pressure, and we're talking about the upper level of being 180 and the lower one being over 100 and 110 or so, we take that very, very seriously. We'd examine their eyes to make sure there's no evidence of the retinal nerves and retinal arteries being involved. And if it's that high, we send them into hospital straight away. I've known several instances whereby I've taken patients' blood pressure. They've been feeling perfectly, and the blood pressures have been sky high. So this is what I mean by saying that it's very important to know what your blood pressure is, and if it is high, do something about it.
Exactly, definitely. So, what are the some as you mentioned that people these said, oh, I can understand my blood pressure is high, I can see that, but you mentioned that it is not true. So, what are the basic signs people should or symptoms? What are some early signs or symptoms or warning signs of high blood pressure that people should look out for?
As I said earlier, the things to look out for are persistent headaches, blurred vision, and also chest pain as well. Chest pain can be a symptom, can be a sign of underlying high blood pressure as well.
Wow. Okay. Indeed. Okay. So in terms of you mentioned about headaches and dizziness. Are headaches and dizziness always relate to high blood pressure, or these could be signs of something else as well?
They could be symptoms of something else as well. They could be symptoms, but they're not symptoms to be ignored. They're not symptoms to be ignored, and and that's what the healthcare professionals are there for.
Mm,
That's what we are there for, to help.
indeed. And how does high blood pressure affect our day-to-day lives? Do our energy level goes down or go up, or we just feel very sleepy, lethargic?
Most people with elevated blood pressure live a perfectly normal life, and again, this is the problem. They don't feel it, and if it's not treated, it can go quite high quite suddenly, or it could affect those target organs and cause catastrophic effects. So if you see your healthcare professional, he diagnoses you with high blood pressure, he will give you some healthy lifestyle advice, and may start you on treatment as well.
Yes, indeed. And healthy lifestyle advice should be taken. It's not, it should not be ignored
Yeah.
by all means. Right. Uh, so you mentioned about the lifestyles. So what kind of a dietary factors we should take on board? And I know you mentioned that smoking and alcohol also contribute towards the high contributes towards the hypertension or high blood pressure. Um, what are the basic things we should be doing in terms of the lifestyle wise?
Okay. So lifestyle advice really, um, would be talking about what you're eating, when you're eating, and your level of physical activity as well.
Hmm.
So, as far as what you're eating is concerned, it's very important to have a low fat diet as much as possible. Um, Limit your intake of red meat, have more white meat, limit your intake of fried food and processed food, more grilled food.
When you say limit, what do you mean by limit? Because people have different meanings of limits. People say, "Oh, I just have one time a day. That's my limit." Some other says, "No, I have 3 times a month. That's my limit." So where does it lies?
Well, that's a very good question. That's a very, very good question. I mean, and the problem with our Asian cooking is that sometimes it's laden with unhealthiness as well. Even that,
Exactly.
and that's probably why it tastes so nice, tastes so good. So look, I always try to tell people to limit their intake of fried food. Maybe have fried food maybe once every 2 weeks, if that. So, and that's just my advice.
Hmm.
And go for the grilled option as much as you can.
Hmm.
I would also limit my intake of processed food, and if not, try to cut it out as much as possible. Increase your intake of vegetables, salads as well, um, and also decrease your intake of salt. The salt intake is very, very important because we tend to put a lot of salt in our food, especially our Asian cooking. So decrease your intake of salt is very important. And then there's exercise, and I cannot emphasize how important exercise is in the whole scheme of things. And when I say exercise, it's not. I wouldn't say go join a gym and go to the gym 3 or 4 times a week. That's not necessary. Just go
I
for a walk.
I need to hold you for a second because we are about to hit the commercial break.
Yes.
Time has passed really, really quickly, just passed like a grain of sand from my hand. So when we come back from our break, I will pick up where we have left off. Like exercise and
Yes.
why it is important and how it can help us maintain a good blood pressure in our lifestyle. Stay tuned. We will be right back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
This is Wayne Turner here, ex-player, coach and head of youth at Luton Town Football Club. I urge you all to listen to Inspire FM, fantastic radio station for you to wake up in the mornings to. 105.1 FM.
AK Windows South Limited, manufacturers and installers of high-quality UPVC windows and doors, bifold doors, composite doors, conservatories, porches, skypods, fascias, guttering, and much, much more. We specialize in double glazing and triple glazing using the best German profile. If you want quality at affordable prices, AK Windows is the place to go. If your house needs a facelift, you know who to trust. For a free quote, call AK Windows today on 01582 483 777 or visit us at Unit 10E, Britannia Estate, Leagrave Road, Luton.
How many times have you needed urgent medical supplies but don't know where to go? At Harris Pharmacy, we take pride in delivering a high-level healthcare to our community. This is why we have services such as private one-to-one consultation, free prescription ordering from GP and delivery to your home, mobility aids such as providing wheelchairs and many other items for everyday use. Call us today on free phone 0800 458 2850 to discuss your medical needs. We are open from 9 a.m. till 7 p.m. Monday to Friday and 9 a.m. till 4 p.m. on Saturdays. Harris Pharmacy, 165 A/B, Dunstable Road, Luton.
Need a ride? Village Taxis has you covered. Going to the airport, station, work, hospital or school? Call Village Taxis on Luton 250 for a quick, reliable service. New drivers wanted? Get registered today and join the Village Taxis team, serving Luton, Central Beds, TfL, Wolverhampton, Hertfordshire and beyond. Taxi rental also available. Download our easy-to-use Village Taxis app or call on 01582 250 250 to book your ride today. Village Taxis, your local taxi company.
Are you looking for a prompt let and comprehensive property management by property professionals? If so, relax and let a safe registered agent take care of all your property matters. Marigold Residentials believe in 100% customer satisfaction and aim to provide quality service at very competitive prices. Why not also let us take care of your property sale? We're now a proud member of the National Association of Estate Agents. We also advertise in local papers free of charge. Visit us at 251 Dunstable Road or call us on 617 617. Terms and conditions apply.
In the time it takes to hear this ad, there will be children in Gaza who will lose their parents. But there is hope. You can make the difference. Right now, MATW is providing emergency care for over 15,000 orphans in Gaza. But we need your help to reach more. Just £10 can provide nutritious meals, clean clothes and bedding, and medical care when needed. Don't turn away from Gaza's orphans. Text orphans to 70560 to donate £10 or visit matwproject.org.uk.
Head over to inspirefm.org to check out our new website. Missed a show or want to listen back to an old one? Want to know about upcoming schedules or maybe keep up to date with events going on? Don't worry, it can be found right here on www.inspirefm.org. As well as that, have a question, query or comment, find the contact details right here and become part of your community radio station. For the community, by the community.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahd Matan, your host for today's evening, and today we are talking about blood pressure, also known as hypertension, its symptoms, causes, and effects on our daily life. With our very own doctor, residential doctor, Dr Adil Khan. Assalamu alaikum, Dr. Sahab.
Wa alaikum assalam, Fahd.
This program is broadcasting live today on 23rd of October 2025, and the time just past 6:30 p.m. We are broadcasting live from the studios of Inspire FM for our lovely people in Luton and surrounding areas of Luton like Dunstable, Harpenden, Bedford. Our positive airways reaching all our listeners who are listening us through Inspire FM radio app or website and viewing us through our Facebook and YouTube channels. Good evening and welcome back. Before we went on break, where I have rudely interrupted Adil in his nice, lovely flow, we were talking about how you can manage hypertension with necessary diet and exercise. And he was giving a very lovely advice about exercise. And I have stopped him saying, sorry, the time has passed. So Adil, can you start from the point where I've disrupted you about exercise?
So exercise is one of the most fundamental cornerstones of treating hypertension, and exercise is very important because what you're doing is exercising the muscle pump of your heart, and keeping that healthy will help keep your blood pressure healthy as well. As I said, most people haven't got the time to join gyms, and when they do, they don't go anyway. So it's very important just to keep it simple. And all you need to do is just go for a simple walk 3 or 4 times a week. Start off with half a mile, work up to maybe a mile if you can, and walk at a good pace. Walk at a good pace. So you walk at a pace where you feel your heart beating faster, you're sweating slightly as well. And if you do this 3 or 4 times a week on a regular basis, that would be good enough. That would be good enough. And we're looking at about 150 minutes a week exercise in that respect.
Mm-hmm.
So that's very, very important. And it's a question of fitting it into your lifestyle. So, when you have these illnesses, most illnesses require diet and exercise to a certain degree, you're looking at a lifestyle choice. You have to change your lifestyle in order to get better. You cannot just rely on medicines at all. You have to look at yourself and you have to look at your lifestyle, and you have to adapt. And these things are very, very important, very, very important, and they cannot be over exaggerated, especially in our community.
Exactly, and that's one of the reasons to highlight the importance. I know GPs like yourself are doing some events for people, for them to come and learn about these issues and problems. I know there's one which has been happening on 10th of November.
Right, yes. I mean, basically, the various primary care networks in Luton have been holding events over the past few years on a regular basis, whereby, we invite people, members of the public, and do random blood pressure checks. And these events have been very, very, very successful. I mean, we found 500 undiagnosed patients with blood pressure in the last few months. So these are patients, these are patients who wouldn't have gone to their GP, just turned up, ad hoc to these events. And we found out they've got high blood pressure, and we referred them back to their GP, and they've started treatments. And this is what I mean about silent killer. These are people who did not know they had blood pressure. And, this is just the tip of the iceberg. We are missing, thousands and thousands and thousands. So, as you said, there is an event being held by the Medics PCN coming up on the 10th of November at the Chorlend Community Centre at 5:30 to 7:30. So go along, please. And they will give you free health checks. They'll be checking your blood pressure. They can do blood sugar testing. and they'll give you advice on your health in general, and they'll give you exercise advice, they'll give you dietary advice, and these are opportunities that everybody should be taking up.
So there should be samosas and mithai as well.
Only for the doctors.
Okay. Right. Okay. So in terms of the as you mentioned about these events normally capture people who do not know. So what are the common causes of high blood pressure in adults? I know you have mentioned few things in the first part of the show, just quickly capturing what are the common causes of the high blood pressure.
Well, the risk factors would be your age, your ethnicity, your lifestyle, your weight.
Okay,
those are the fundamental things.
So what about people who does it comes as like things like hereditary as well, like if your parents have it or your grandparents have it, you will automatically get it?
Well, not necessarily automatically, but you have a high chance of suffering from high blood pressure if it is prevalent in your family. Yes.
So should people who have family history of high blood pressure should be cautious?
We should all be cautious. It's not just a family history. We should all be cautious. Because as I said, what we found in with our PCN projects in the community, we are finding so many people with high blood pressure in the community who haven't even been to the GP, haven't been to see any health professional, and they weren't aware that they had high blood pressure.
Mm-hmm.
So these, and this again, I cannot overanswer. This is what I mean by a silent killer.
Indeed. So how can you mentioned about if high blood pressure is not controlled, it will affect your different parts of the organs. So how an uncontrolled blood pressure affects kidneys, hearts, and other organs of our body over the time frame?
So to put it in very, very simple terms, if you've got very, very high blood pressure, the elasticity of the walls of the blood vessels, they become more inelastic as time goes on. Okay, they can become a lot more stringent, a lot more tougher, and a lot more inelastic. That's one thing. When you're exposed to a high blood pressure for a very long time, the very, very, very small blood vessels, what we call the micro blood vessels, can burst. Now, one or two of bursting won't make any difference, but when you have this accumulative effect over a period of time, it does have an effect, and that's why we see target organs being damaged, like your kidneys, like your brain as well. Even your eyes. The blood pressure can affect your eyesight as well. It'll affect the blood vessels at the back of your retina. So this is the effect the blood pressure will have over time.
Mm-hmm. Now, as the word says, hypertension. Let's talk about tension itself. Does the high blood pressure play a role in stress? And what does the role of stress management play in managing the high blood pressure? Yeah, that's the right way of saying. What does the stress management play in managing the high blood pressure?
So prolonged exposure to stress over a long period of time will definitely have an effect on your blood pressure in most people. So part of the treatment would be to relax and look at the factors which are causing the stress as well. And, in this day and age, it's not always easy to negate those factors. It's not easy to make them go away. But I think it's a question, therefore, of developing ways of coping with the stress. And certainly exercise is one of the best stress busters, to tell you the truth.
Mm-hmm.
Exercise has been known to decrease stress levels. So this is why I tell people, if you are suffering stress, just try exercising. One of the management for insomnia, for not being able to sleep, is one part of the management is exercise as well. Because when you exercise, you release feel-good hormones.
Okay.
And they help you to relax. And they help you to feel better as well.
So it's like a kind of a cycle.
Absolutely. And if you exercise regularly, there are a lot of people who exercise regularly actually become addicted to exercise. They get a high out of it.
Yeah, that's one of the biggest problems, because when you are exercising and when you are on that train or in that kind of a regime 3 times a week or 4 times a week. You are in that regime, and something happens, and you just come out of that regime. It's really hard to put us back on that regime, isn't it?
It is very difficult. It is very difficult. It is, and but this is where your discipline comes in. This is where your discipline comes in, and as I said, you don't have to develop a fancy exercise regime. Just go for a walk, and you can do that on holiday as well, can't you? So it's a no-brainer. It's a no-brainer.
But the problem is the rain. What shall we do with the rain? I'm laughing because Baz's Dr. Talib Bakar's last words to me just came in my mind. It was, "You have more excuses than a pregnant woman." Excuse me.
And I
Sorry.
can actually imagine Talib saying that as well. But again, if you're going to look for excuses, you'll find excuses around every corner. You will. Buy a treadmill. Buy a little walking treadmill in your house then. Okay, that's what you can do. They're not that expensive, to tell you the truth.
Okay. Now, the food is one of those very things which we love in our culture. Now, you mentioned about reducing the red meat, increasing the white meat, and cooking our food less oily, less greasy. Is there a regime of food which we can change in our lifestyle, which will help us control our blood pressure, our diabetes, and all sort of comorbidity problems simultaneously?
I think, look, the secret to everything is moderation. And that's very, very important. It's moderation.
Which we do not have.
What is fantastic about our community now is that there's so much information available online with regards healthy Asian eating. It is just incredible the amount of cookbooks available now, which concentrate on healthy Asian diet. There's so much out there now, and there's absolutely no excuse for going out and looking at this and taking it in. I just went onto the Diabetic UK website, and the section about Asian food on there is the best section on there, to tell you the truth. It is absolutely unbelievable. So the information is there. And we've just got to go outside and we've got to pay attention to it.
Dr. Baz is saying 20 squats twice a day effect can do indoor as well.
Yeah, absolutely.
20 squats. Definitely start doing that. Need to start doing that. Okay. So in terms of practical ways of managing and reducing high blood pressures, we can change our diet, and diet only cannot help. So should we reduce things like salt or processed food?
Yes,
make difference.
Salt. Reducing your salt intake is very, very important. Again, our Asian diet it's been known to have high salt intake historically, so reducing our salt intake is very, very important.
Mm-hmm.
Decrease your intake of processed food, and that processed food will have a higher degree of fat in it, and also, there's a link between increased intake of processed food and other illnesses as well. So it's very important to decrease your intake of processed food for that reason.
Mm-hmm. Indeed. And how you mentioned about people who have high blood pressure or end up in the GP surgery with high blood pressure, they're often given advice to check their blood pressure regularly at home. Now, the ones who do not have high blood pressure, how often they should check their blood pressure at home?
That's a very, very good question. That is a very, very good question indeed. So, if you haven't got high blood pressure, I think it's probably worthwhile having your blood pressure checked maybe, once every 5 or 6 months, okay, at home. No need to go to a GP surgery to get it done, but just get it done, just to get it checked. But if you have got high blood pressure, it's important to keep on top of it. It is very, very important to keep on top of it.
Mm-hmm. And in terms of trust, now that's something which we will always struggle with. Can we trust our home monitoring systems
Yes, I mean most of the modern home blood pressure monitors are very, very reliable indeed. Much more so than before.
Now, one of the biggest problem which I normally, if I talk about myself or people in my family, if we take blood pressure from our right hand, it comes in a different reading than our left hand. Why is that? And is there a certain hand need more blood pressure taking than the other one?
There are certain conditions which can cause your blood pressure to be different on both sides, but that's quite rare. That's quite rare. But another important factor I must say is this: the size of the cuff matters as well. So if you've got a large arm,
So size matters.
it's a family show, Fahd. If you've got a large arm, you have to have a large cuff, because if you put a regular cuff and measure your blood and if you've got a large arm, you will get you won't get a correct reading at all. You'll get an artificially high reading. So if you've got a large arm, it's important to have a larger cuff. So if you're buying a blood pressure machine, ask the pharmacist to have a look at your arm, and if he thinks it's a large arm, he will give you a blood pressure machine with a larger cuff, because that makes a lot of difference.
Okay, what's the difference? Sorry, I didn't get it.
So if you have a large arm and you use a regular size cuff, the blood pressure will come out artificially high.
Okay.
And if you put a large cuff on a large arm, you'll get the proper reading.
So what about large cuff and a smaller arm?
It'll probably slip off.
Yeah, that's a really nice one. Yeah, exactly. It just threw my chain of thoughts completely. Okay. So let's talk about how often. So people who have been asked to take blood pressure at home, how often they should be taking blood pressure?
Again, it depends on your level of control. On your level of control. I mean, if your blood pressure is not under control, your GP will be asking you to do maybe a week or two's worth of blood pressure readings. Then you'll give it into your practice, and they'll monitor and they'll look over the number of readings and tell you whether you need any adjustment in the treatment. When you start treatment, when you go to your GP and let's say they diagnose you as having high blood pressure, they will analyze your urine to make sure that there's no kidney damage. They may do an ECG to make sure that there's no underlying heart problems as well. Because if you've had high blood pressure for a very long time and it's been undetected, it can actually cause an enlarged heart. So these things are very, very important. They'll do a series of blood tests as well, and the blood tests will be there to look at your kidney function, your liver function, your thyroid function, your cholesterol level, and your blood sugar levels as well. And your treatment will be there, and the treatment you have will depend on your age as well, and also your ethnicity, because Afro-Caribbean people do not respond to certain blood pressure treatments the same way as we or Caucasian people do. So this is quite an anomaly. So the GP will start you on certain treatments, start you on a low dose to begin with, and work their way up. In some people may need 2 or 3 different blood pressure agents in order to control your blood pressure. So it's never get despondent if you're taking your treatment and it's not being controlled with one medication. Some people need 2, some people need 3 different combinations of blood pressure treatment in order to get controlled.
Yeah, some people love on they take medical cocktails.
Yes.
Okay. Coming back on the topic in terms of blood pressure, can persons go to pharmacy to take blood pressures?
Yes. As I said, if you're 40 and over, you will be able to go to the pharmacist and have your blood pressure taken for free. Obviously, you can visit your GP practice, and your blood pressure can be taken by one of the healthcare professionals there.
Mm-hmm.
So yeah, absolutely, and as I said, there are so many medical roadshows, health promotional roadshows, which go on these days, and it pop along to them, please. And as I said, we find so many people with undiagnosed blood pressure in this way. It's mind-boggling. It's actually scary to think that how many people out there who are undiagnosed. It's very scary.
Exactly. And if you can't see your GP, definitely go to those health shows, because you will be able to see your GP as well over there.
A doctor, a healthcare professional.
A healthcare professional. And the next one is on 10th of November at 5:30 p.m.
That's right, Chorlend
Community Center. Please come. You will get your BP check, your lifestyle. You will get lifestyle advice. And it's a free, and everybody's welcome, including they will be checked for AF screening as well.
Absolutely.
Exactly.
Absolutely.
And on the final note, wow, the time has passed really quickly. We just have just around 4 minutes remaining. So what are the messages you like to give to our listeners about taking hypertension seriously and making a small change for better health? Not big heart.
Okay.
Better health.
The fundamental thing is get your blood pressure checked.
Okay.
If you forget anything I've said on this show, just take home. Get your blood pressure checked. One way or the other, please do that.
Mm-hmm.
Okay. Healthy lifestyle. That means what you eat, stop smoking, decrease salt intake, increase your exercise level of physical exertion.
And in terms of sorry, completely. There was a message comes from one of the listeners saying, let's try to get at five mentions for people who are attending our events. Nurses and doctors will be there. Prevention.
Yes, absolutely. Prevention is better than cure.
Indeed. So I know I'm slightly deviating from the topic, and very quickly, what's the difference between a low blood pressure and a high blood pressure? There's another question just mentioned in one of the part which I forgot to ask.
Yeah, some people do suffer from low blood pressure. So when we're talking about the upper level, the systolic level, some people's systolic level could be 100 or less.
Mm-hmm.
And some people, it doesn't affect them at all, but very often they can cause dizziness, especially when they're standing up for long periods of time.
Mm-hmm.
So if your blood pressure is low and you stand up, in some people, the blood pressure sinks even lower, and that can cause dizziness, and it can even cause fainting as well.
Mm-hmm.
So that can be a problem, especially in the elderly. So there are certain elderly people who may be on medication which lower their blood pressure, and if it's going too low, they can actually fall over and cause very serious damage to themselves. So low blood pressure is something to be wary of as well. Absolutely.
Definitely. And that's something we will discuss next time. We will definitely discuss next time about low blood pressure and other causes and symptoms of those things. And in terms of, you said bigger heart is not better because it can cause those issues, isn't it?
Yeah. So if you've got high blood pressure for a very long time, as I said, your heart will literally be pumping harder again than it should be.
Mm-hmm.
And if a muscle works harder than it should be, it gets larger, and
Mm-hmm.
that's something that will happen to your heart. And this is unhealthy,
Mm-hmm.
because then what will happen is, as I said, the muscles in the heart lose their elasticity and they don't pump as efficiently, and you develop something called heart failure.
Mm-hmm.
And heart failure is a big killer. It's
Indeed.
a big killer in our community.
Indeed.
It's a big killer in our community.
On that note, Adil, thank you so much. A small positive message from you last.
Small positive message: eat well, be healthy, exercise.
Indeed. And that's all for today's folk. Inshallah, we will be back again next week with a different topic, talking about healthy and preventions about things. If you missed any part of our show, you can always watch, go and watch back on YouTube or Facebook, as well as we do a repeat on every Thursdays and Saturdays. listen to us. Remember us in your duas, and definitely keep watching Health and Fitness Show and stay healthy, fit, and remembrance of Allah all the time. Assalamu alaikum.